most common mode of stick injury was with the wooden stick, which accounted for about 31.25%. In that clinical examination, most commonly it was associated with a full thickness corneal tear, and the patients underwent wound exploration with corneal tear repair with cataract extraction. Other findings included partial thickness corneal repair and a scleral tear. We did a microbiological analysis in which most common organism we found was alpha hemolytic streptococci. We didn't find any growth in 6 cases. We found bacillus species in 3 and enterobacter aerogenes in 1 case. Majority of the patient underwent intravitreal antibiotics, vancomycin and ceftazidime with the core vitrectomy, 88 majority of the patients. And final visual acuity was more than 660 for more than 50% of the cases. 18.75% cases went into phthisis. So coming to the discussion, the mean age of our study was 7.65 years. Time of presentation about a day. Males are more commonly affected. Mode of injury was a stick. Most common finding was a full thickness corneal tear. Most common organism we isolated was alpha hemolytic streptococcus, and we had a final visual outcome of more than 6/16, 50%. If we compare with the other studies, our sample was having 16 cases as compared to others in a 1 year period. The mean age of presentation was 7.65 years. Most common gender affected was male, as in seen in other studies. Most common mode of injury in our study was a wooden stick injury. In some other studies, broomstick and scissor injury was also seen. The time reported in most of the patient, time of presentation was within 1 day. So mostly that attributed to the good visual outcome. Microbiological profile varied in almost all studies. Most commonly streptococcus was isolated. We isolated alpha hemolytic streptococcus, and majority of our patients underwent vitrectomy, leading to a visual outcome of more than 6/16, 50% of the cases. So to conclude, a successful anatomical and visual outcome can be attained in children with post-traumatic endophthalmitis with early presentation, prompt and aggressive treatment. Thank you.
Thank you so much.